Salmonella. It's been all in the news with the peanuts in the last couple of months, but hey, it also happens in the equine world as well. Dr. Mike, thanks for joining us today.
Alan, great to be here. Glad to be here today.
First of all, tell me and the viewers exactly what salmonella is.
Well, salmonella is a bacterial infection that can happen to animals, and as we know from you mentioning in the news, and it can be quite devastating. It can actually kill an animal if they get a very severe case of it.
So we've seen that happen in the news with the humans lately with the peanut consumption, and also it can take the life of a horse as well. What causes the actual disease of
Well, what
salmonella?
happens is salmonella is a normal bacteria in the floor, the guts of a horse within their gastrointestinal tract. And when a horse gets in a stressful situation, they start to shed these bacteria. And horses can pick it up just like people, fecal to oral route. In other words, there's feces on the side of a stall door or a trailer where a horse had loose stools, and the next horse comes along there, licks or sniffs it, and then next thing you know, you've got a sick horse too.
So what are some of the things that can make my horse susceptible to the salmonella?
Well, probably the biggest thing that we'll see is horses that are shipped, stressed, things like that. Which goes back, if you got a horse with loose stool, don't take him to the show. Leave him home. You don't want to infect somebody else's horse.
So putting everybody else's horse above your own in that particular situation, what are the treatments for salmonella? It's not a death sentence, is it?
No, it's not a death sentence. Most of them, 50% of them will recover on their own. Most of the time, it's just like us when we get sick. You need fluids. We give a lot of IV fluids to them, keep them hydrated, and most of them will do fine. Matter of fact, I'd go and say that most of them, once we get them on fluids, they're really good.
And they also say, we read about a lot of things in the equine journals and such, that the babies, the foals, are particularly susceptible.
Foals are very susceptible because one is a stressful time in the mare. We're going to take her to a breeding farm, someplace that's not normally her place, let her fold out, and if she's a latent carrier of salmonella, she may start shedding the bacteria in her feces, and of course there's the foal, and there's also feces back there around that back end of the mare. Picks it up, and now we got a sick baby on our hands.
Okay, I start seeing some of these signs that you're talking about, the loose feces and such as that, the loose stool, and I'm starting to think I may have the salmonella. What kind of treatments do we have when I go to my veterinarian to treat this salmonella?
Well, the first thing they're going to do is they're going to take some of that feces and send it off for a culture. That way we know exactly what we got, and they'll do a thing called a PCR. It's this very special test that can let us know within a day whether that horse is positive. But the biggest thing they're going to do is put a catheter in that horse and give it IV fluids and keep it hydrated. They may or may not start the horse on antibiotics. Kind of depends on how sick it really is. Most of the time they don't. And it's just supportive care.
Now, why would you not want to use the antibiotics on a horse
Well,
like
in
that?
some cases, the antibiotics will actually make the disease worse. And they'll shed more bacteria in their feces. So it's kind of a chancy thing there. And you just want to watch that individual horse and see what you do with them.
Okay, I come to you, my horse is diagnosed with salmonella poisoning. I got to get my words right. I'm scared of this disease.
Yes.
Okay, I know it can kill my horse, and we've seen in the news where it can kill people. Can it be transferred from horses to humans?
Yes, it can, Alan. That's why it's so important that when we go out to the barn, that we establish, a protocol for just hygiene. Wash our hands every day. Wash our hands when we're finishing up around lunchtime, and most importantly, if you do have a sick horse, the tools that you use on them, you don't take and use on the other horses.
Well, Dr. Mike, thank you. That's at the clinic.